Welcome all of you to the mock test answer key explanation series for Government Nursing Officer exams, part 10. Let us go to the questions and explanation. The first question is, complementary feeding should be initiated at the completion of option A 3 months, option B 9 months, option C 12 months, and option D 6 months. The right answer we can see. The right answer here is option D, 6 months. WHO recommends the complementary food can be started at age of 6 months. At 6 months, babies need more nutrition like iron and zinc from solid foods. Babies are developmentally ready for the other foods at the age of 6 months. You will start the supplementary feeding with pureed, mashed, and semi-solid foods. Gradually can be increased to more consistent food and more varieties. Next question. Gas used in laparoscopy to inflate abdominal wall is option A O2, option B CO2, option C N2, and option D air. Let us see the right answer. The right answer is option B CO2. Carbon dioxide is the gas most used to inflate the abdominal wall during laparoscopic surgery. This process is called pneumoperitoneum. You can see the diagram showing the gas-filled area in abdomen. Next question. Where is oxytocin synthesized? Option A. Paraventricular nuclei of the hypothalamus. Option B. Paraaxial nuclei of the hypothalamus. Option C. Hypophyseal portal plexus, and option D, hypothalamo-epiphyseal plexus. Let us see the right answer. The right answer is paraventricular nuclei of the hypothalamus. Let us see the different parts of hypothalamus in this chart. Oxytocin is synthesized in supraoptic and paraventricular nuclei. Paraventricular nuclei is oxytocin synthesis. Oxytocin is stored in posterior pituitary. Paraaxial nuclei is regulating the energy balance and stress, etc. The hypophyseal portal plexus connect the hypothalamus to the anterior pituitary gland. So these all are the different functions of the hypothalamus portions according to the different options given in the question. Next question. Ramsay scale is used in ICU for assessing option A, level of pain, option B, level of consciousness, option C, level of sedation, option D, level of hemodynamic status. Let us see the right answer. The right answer here is option C, level of sedation. So Ramsay scale is used for assessing the level of sedation in ICUs. These all are the sedation response score from 1 to 6 or 1 to 8 according to different levels of patient status, and the level of sedation will be assessed. Next question. What is the name of the muscle that extends from sphenoid bone to the mandible? Option A, pterygoid. Option B, masseter. Option C, sternocleidomastoid. Option D, trapezius. The right answer is option A, pterygoid. See the different muscles according to this question options. The detailed anatomical explanation will be given in the musculoskeletal system. Now, related to this option, we are going through the different muscles. Pterygoid is sphenoid bone to mandible. You can see the diagram here. Masseter, rectangular muscle located in the jaw. The shape is also mentioned. It is a rectangular muscle and located in the jaw. Sternocleidomastoid, a paired muscle located in the anterior portion of the neck. Trapezius is a large or triangular muscle in the upper back. Let us see the memory tip here. Pterygoid, sphenoid bone to the mandible. Masseter, rectangular muscle. You can see the color coding here for the shape and the location jaw. Sternocleidomastoid paired muscle in the anterior neck. Trapezius is triangular muscle in the upper back. Next question. Red color is side effect of which antitubercular drug? Option A, pyrazinamide. Option B, rifampin. Option C, ethambutol. Option D, isoniazid. Let us see the right answer. The right answer here is option B, rifampin. Rifampin or rifampicin is hitting red colored urine. You see the R is highlighted for connecting these words. Patient is taking rifampicin will have red or orange discoloration of urine and possibly other body fluids. Next question. Choir's rattling sound in airways is known as option A, rhonchi. Option B, wheeze. Option C, crackle. Option D, stridor. Let us see the right answer. The right answer here is option A, rhonchi. Abnormal breath sounds include rhonchi, choir's rattling sound like snoring. It is like snoring. Wheeze, high-pitched whistling sound. It is a high-pitched whistling sound. Crackling, discontinuous, interrupted bubbling or crackling sound like pulling Velcro open. You have seen the Velcro zip. So when you are pulling the Velcro zip, there is a kind of sound. That kind of similar sound is heard in crackle. Stridor, it is a high-pitched, noisy breathing sound which will be always related to the airway obstruction from foreign body or some other particles. Next question. Psychosocial development stage of infant is option A, autonomy versus shame and doubt. Option B, trust versus mistrust. Option C, initiative versus guilt. And option D, industry versus inferiority. The right answer we will see here. The right answer is trust versus mistrust. You can see the different psychosocial development stages in this chart. Infant, trust versus mistrust. Toddler, autonomy versus shame and doubt. Preschooler, initiative versus guilt. Grade schooler, industry versus inferiority. Teenager, identity versus role confusion. Young adult, intimacy versus isolation. Middle adult, generosity versus stagnation. And old adult, integrity versus despair. Let us have some memory tricks for remembering this vast topic. Just see this kind of tricks and remember this with these interesting sentences like infant need trust, toddler need autonomy, preschooler has initiative, and school is an industry. Teenage confusion, young adult is intimacy and middle adult is generosity. Old age there is a skin integrity issue, that is integrity versus despair. So all the keywords are connected here so that you have to identify from the options. This is a memory trick. Next question. Recommended minimum scrub time for using surgical hand wash. Surgical hand wash. You have to see the word, not medical hand wash. It is a surgical hand wash. Option A, 1 minute. Option B, 2 minutes. Option C, 5 minutes. And option D, 10 minutes. Let us go to the right answer. The right answer here is option C, 5 minutes. We will see the guidelines and priorities for this kind of questions. WHO and CDC recommended timing for hand washing for surgical hand washing is 3 to 5 or 5 minutes. Next question. What immunization is given at birth? Option A, BCG. Option B, hepatitis A. Option C, DPT. Option D, MMR. Let us see the right answer. The right answer here is option A, BCG. See the chart with memory tips and diagram. BCG and OPV at birth. DPT after 2 months. Hepatitis A after 12 months. MMR is after 50 months. So this is according to the order, birth to 50 months. So related these options, BCG is the right answer here at birth. Next question. Higher heat resistant vaccine is option A, BCG, option B, TT, option C, OPV, option D, MMR. The right answer here is option B, TT. Heat-resistant vaccines are diphtheria, TT, and HP. Oral polio vaccine is the most heat-sensitive vaccine. BCG, measles, MR, and Japanese encephalitis vaccine is also heat-sensitive vaccines. Next question. Functional nursing is a method of providing option A, care of records, option B, case management, option C, patient care, option D, equipment care. The right answer here is option C, patient care. You can see this application level question by this strategy. The question is functional nursing is method of providing care of records. It can be eliminated because that is medical record section, which is not our job. Equipment care is with biomedical or inventory managers, so that is also not related to the nurse. So the nurse will be with case management and patient care. In that, case management is more related to the case method, and this functional nursing is more related to patient care. So this option from these two can be selected. This is the way of doing this kind of application level questions. Next question. Route of administration of rotavirus vaccine is option A, intramuscular, option B, oral, option C, subcutaneous, and option D, intradermal. The right answer we will see here. The right answer is option B, oral. Both rotavirus vaccines are administered orally by putting drops in the infant's mouth. Next question. Which disease is the dementia associated with asymmetric atrophy of the frontal and temporal lobes? A, vascular disease, B, Huntington disease, C, Jacob disease, D, Pick's disease. Let us see the right answer. The right answer here is option D, Pick's disease. Pick's disease is frontotemporal dementia, FTD. Huntington's disease or HD is an inherited disorder by mutation in a gene located on chromosome number 4. It causes neuron to gradually break down and die. Jacob disease or CJD. It is a brain disease that is caused by the abnormal brain protein called prions. The tip is given here for your memory in exam hall. Pick's, FTD, frontotemporal dementia. HD, chromosome 4. Huntington disease is for chromosome number 4. It's an inherited disease. CJD, the Jacob disease is by the prions. It is by the protein prion. Next question. Bishop score is used in option A, induction of labor, option B, newborn assessment, option C, assessment of pain, option D, assessing degree of bedsore. The right answer here is option A, induction of labor. Memory tip is given the top and the explanation down. Tip is labor bishop, bedsore Braden, newborn, Apgar, Geop was paid. So induction of labor is by bishop score, by the cervical ripening. Newborn assessment is by Apgar score. Assessment of pain by many scales like Geop scale for children's surgical, post-surgical assessment, then VAS scale, NVPS scale, etc. Assessing degree of bedsore is by Braden scale. Next question. Thromboangiitis obliterans is also known as option A, metabolic disease, option B, arterial flutter disease, option C, aortic obliterans, option D, Buerger's disease. Let us see the right answer. The right answer is Buerger's disease. Thromboangiitis obliterans or TAO is also known as Buerger's disease. It is a recurring progressive inflammation and thrombosis of small and medium arteries and veins in the hands and feet. You can see the diagram also here. Next question. A patient blames his family environment for his chronic alcoholism. Which defense mechanism is being used by the patient? Option A, reaction formation. Option B, rationalization. Option C, projection. Option D, sublimation. Let us see the right answer. The right answer here is option B, rationalization. Let us see the defense mechanisms related to this question. Reaction formation is the expression of feeling opposite to true feelings. For example, insulting someone with whom romantically interested. This is kind of technique used for the lovers in the beginning. Rationalization, an attempt to find logical reasons for behavior. Here, for the alcoholism, he is finding the logical reason for the alcoholism behavior as his family issues. So this is rationalization. Sublimation, defense mechanism that redirect unacceptable impulses to socially acceptable behavior. For example, a short-tempered, angry man will perform well in sports to channel his unacceptable behavior to a acceptable form. Projection, the process of displacing one's feeling to different person or animal or object. For example, a wife is attracted to a male co-worker but cannot admit her feeling. So, when her husband talks about a female co-worker, she will become jealous and accuse him of being attracted to the other woman. So, the female, her fault, she is trying to put it on her husband. This kind of projection, this kind of displacing others' feeling is projection. Next question. What is the other name of pyridoxine? Option A, vitamin B2. Option B, vitamin B12. Option C, vitamin K. Option D, vitamin B6. Let us see the right answer. The right answer is vitamin B6. Let us see the chart of vitamin B complex here. The color coding and the numbers you have to remember for better memory in exam. B1 starting from B1 thiamine, B2 riboflavin, B3 niacin, B5 pantothenic acid, B6 pyridoxine, B7 biotin, B9 folate and B12 cobalamin. So from thiamine to cobalamin, you can see TRNPPBFC. This is the code 1, 2, 3, 4, 1, 2, 3. There is no 4, 5, 6, 7, 9, 12. So 1, 2, 3, 5, 6, 7, 9, 12. TRNPPBFC. So thiamine to cobalamin. This is the vitamin B complex names and the numbers. Next question. Which value of HbA1c in a diabetic patient is indicating good control of blood sugar level over a period of months? Option A 6 to 8, option B 8 to 10, option C 10 to 12, option D 12 to 40. Let us see the right answer. The right answer here is option A 6 to 8. Let us see the diagram of HbA1c normal value. It is around 6. See from here 5% to 6. This is in the green zone, safe zone. From here onwards, it is going to the dangerous red zone. This 7 above is very dangerous. You can see the color coding here. So, you have to know the normal values of each parameter for answering this kind of question. I will discuss this detail in about another special section. Let us go to the next question now. Next question. Koplik spot is the typical sign of option A, pertussis, option B, mumps, option C, measles, option D, diphtheria. The right answer here is, let us see the right answer, option C, measles. Koplik spots are the peculiar spot present on the buccal mucosa in measles. You can see the spots in the buccal mucosa. These kind of questions are very much important question because these are keep on repeated in many government exams. So be careful about this kind of questions. Next question. Which of the following food should be avoided when the patient is with gut? Option A, carbohydrate rich food. Option B, thiamine rich food. Option C, fiber rich diet. And option D, purine rich diet. So in gut, which kind of diet is restricted? The right answer we can see. The right answer here is purine rich diet. Let us see the relation between purine and uric acid or GOT. Foods which have high purine levels contribute to high blood levels of uric acid. So purine is related to uric acid. That's why it is not advisable in GOT because GOT is related with the high uric acid levels. So GOT, purine restricted diet. MAOI, monoamine oxidase inhibitor, tablet taking. Then thiamine restricted diet. Diabetes, carbohydrate you have to control, and hypertension and CKD, salt restricted diet. Next question. Which committee is known as the Health Survey and Planning Committee? Option A, Board Committee. Option B, Srivastav Committee. Option C, Karthar Committee. Option D, Mudaliar Committee. Let us see the right answer. The right answer here is option D, Mudaliar Committee. Tips here is Mudaliar Plan, Board Development. Srivastav, Medical Education. Karthar, Multi-Purpose Worker, MPW. So Mudaliar Committee was Health Survey and Planning Committee. Board Committee was Health Survey and Development Committee. Srivastav Committee was Medical Education and Support Manpower Committee, and Karthar Committee was Committee on Multi-Purpose Workers. Next question. Which part's function is transmission of sound vibration to the internal ear? Option A, eustachian tube. Option B, vestibule. Option C, tympanic membrane. And option D, auricle. Let us see the right answer. The right answer here is tympanic membrane. Let us see the ear and its anatomy on a quick basis. Auricle pinna is collect sound and transform it. Tympanic membrane, transmission of sound vibration to the internal ear. Vestibule, it is functioning for maintaining balance. Eustachian tube is balancing the pressure in the middle ear, and it is draining the fluid from the middle ear as well. So these all are the different functions of different parts of ear given in the options. Next question. In general anesthesia, which sensation disappear at last? Option A, smell. Option B, vision. Option C, touch. And option D, hearing. Let us go to the right answer. The right answer is option D, hearing. In general anesthesia, hearing disappear at the last. General anesthesia, you can see the chart here. It is general anesthesia with systemic action, and it will induce the altered consciousness. Your consciousness will go. Then systemic nullification of pain response. So you will not feel the pain from there. That's why the anesthesia is giving. Then you will lose sensation from light or vision. Vision will be lost first. Taste or tongue function will be lost. Then touch of skin or pain will lose. Smell by the nose will be disconnected, and finally last the sound from ears are disconnected. So hearing is the last function lost during general anesthesia. Next question. The lens which is thicker in the middle than the edges are called option A, concave lens. Option B, biconcave lens. Option C, convex lens. And option D, plane mirror. Let us see the right answer. The right answer here is convex lens. So it is thicker in the middle is convex lens. You can see the diagram here. This is the convex lens. This is thicker in the middle and thin in the edges. Here concave lens, you can see thin in the middle and thick in the edges. So concave lens is thinner in the middle. Convex is thicker in the middle. Biconcave or biconvex both having both sides convex is biconvex and both side concave is biconcave. Then plane mirror is a flat mirror. So these all are the different options and their explanation. So we are winding up with this topic now. Next topics will be continued soon. Thank you all for watching this video. Your valuable participation is inevitable for continuing this series. Please like, share and subscribe for more videos related to